Someone in the US has a heart attack every 40 seconds, but would you know what to do if it happened to you? February is Heart Month. Today we're focusing on how to recognize and survive a heart attack. I'm Laura Wheatholder. I'm a registered nurse and community outreach coordinator for Blessing Health System. I'm joined today by cardiologist Dr. Jeffrey Cook with Blessing Heart and Vascular. Dr. Cook, can you take a minute to introduce yourself?
Good morning. Thanks for having me. So I'm Dr. Cook. I'm one of the interventional cardiologists. Basically, in a way, kind of like a expert in treating heart attack and blockages in the heart arteries. One of three doctors in town that kind of perform that function. I've been at Blessing for over 4 years, going on 5 years. I also treat heart valves and kind of general cardiology as well.
Okay, well, thank you so much for joining us today. Let's start with some basic background information. What is a heart attack?
So heart attack, in the medical world, we call it myocardial infarction. Basically, what it is an abrupt cutoff of blood flow to one of the heart arteries. People often think of like blockages happening in a pipe where it gradually gets smaller over time. And that's partly true what happens in the heart, but more often than not, the blockage that becomes a heart attack is only moderate, maybe in the range of 50 to 70%. And the lining of the artery is filled with cholesterol, and at a certain point, the lining will rupture. And that allows the cholesterol plaque, but also other kind of clot forming factors to spill into the artery. And so you kind of go from a moderate blockage to all of a sudden a severe or complete blockage of the heart artery. And the patient will experience symptoms, usually some type of chest pain.
Okay, so heart attack is typically, like as you said, reduction or abrupt stop of blood flow to an area of the heart. You mentioned symptoms; they can be difficult to recognize. You mentioned chest pain, but they're not always as obvious as some people might expect them to be. Some can be subtle. So, what symptoms should people be watching for?
So commonly, people will experience chest pain or pressure. Oftentimes, they'll kind of indicate there's a heaviness or a pressure in the center of the chest. I mean, everybody's probably heard of elephant sitting on my chest. That's kind of the most common, symptom that you would think of with a heart attack. A lot of times it's associated with shortness of breath. And also there can be some radiation of the discomfort up to the jaw, into the shoulders, or down the arms, be very common. Also, sweatiness, in the case of a sudden onset of a heart attack, people often get very sweaty. Sometimes, like in the weeks prior to your heart attack, you might feel, some of that chest pain when you're doing exertion, like walking up an incline or carrying the laundry basket up the stairs. You might have chest pain that goes away when you rest, kind of like a herald symptom. So that would be, the most common way that people experience heart attack.
And now, continuing to talk about symptoms of a heart attack for women, symptoms might be different. I understand. Is there anything that maybe women should not discount as something else that they might think, it's definitely not a heart attack. It's something else, and I'm not even worried about it.
So studies are pretty clear that women tend to get treated less aggressively up front when they come into the emergency room with their heart attack. And I don't know if that's because women are tougher and they try to, they're a little more stoic with their symptoms. But I think a lot of times it's like you said, the women experience it a little bit different. You may not have kind of like the classic cinematic, chest pain. Maybe more so the shortness of breath component can come to the forefront. Also, maybe pain between the shoulder blades is a common one that women will experience, as opposed to in the front of the chest. And then, I've seen cases, there's a lot of people present in all different ways, but I've seen cases in women where they just come in and they say, I just don't feel right. I feel extremely fatigued. I feel like I don't want to get out of bed today. And sure enough, when we put the EKG on them, they're in the middle of, the big one, a classic heart attack. So, and so I would say women, if you do feel that sudden onset of severe shortness of breath, take that very seriously, and don't try to downplay the symptoms.
So I think for both women and men, the maybe takeaway is know what your normal is. If it's not normal, definitely take it seriously, especially if you have concerns about maybe being at risk for a heart attack. We do occasionally see patients who are experiencing heart attack symptoms who are hesitant to call 911. They don't want it to be a false alarm, or perhaps they think that they can get to the hospital faster if they drive themselves, or have somebody drive them. Why is that just a terrible idea? Why should people always call 911 if they think they're having a heart attack?
So you're right. So people, we see it a lot, and we've seen it more lately, even in the COVID era, because people are afraid to come in. If it is nothing, they can make the assumption that they would maybe put themselves at risk and get exposed to COVID, when their chest pain might be something else. And I think that's probably the biggest mistake that people make, would be to try to assume that it's something less serious. Sorry, my phone just went off. But
You're right.
uh, people might make the assumption that they're just having reflux, or they might make the assumption that they just have the flu. We've kind of heard any number of different things. A common thing that'll happen is that you'll start having chest pain as the night is getting later, and make the assumption that maybe if you just go to bed, that it'll go away by the time you wake up. But unfortunately, oftentimes it kind of gets worse as the hours go into the morning. So people often will come in the middle of the night, and at that point we have to call a bunch of staff in to take care of it. But to your question about why is it a mistake to wait? Basically, if the artery has closed, like we were talking about, the clock starts ticking in terms of how much we can save, in terms of the heart tissue. So a good rule of thumb is that by 3 hours into your heart attack, that there's diminishing marginal returns in terms of how much of the heart we're going to be able to save. The other thing to be aware of is that 60% of deaths occur within the first hour. So if you can quickly get yourself into the hospital and get the artery opened, that's going to go a long way as far as saving your life. We always want people to call 911. The ambulance will be able to come to your house, safely take you to the hospital. But if things get unstable on the way, especially like a rhythm issue, they can treat that. They can also perform CPR and shock your heart back into rhythm if that becomes an issue on the way. All of those obviously can't occur if you're driving yourself. And also, the worst case scenario with that would be if you do have a rhythm and your heart's arrhythmia and your heart stops while you're driving in, you could get in an accident and you could put other people at risk too. So the first best thing that you should do, if you even have a question that you might be having a heart attack, is call 911.
So the takeaways for that would be minutes equal muscle. The longer you wait, the more heart tissue that dies. And the less likely you are to be able to salvage that tissue with intervention. The other thing important to remember is that our paramedics and EMTs are trained to recognize and begin treatment. They also notify you guys right away, right? If they think it's a heart attack, they're calling ahead and letting you
Yeah, I
know.
mean, they can perform an EKG in the ambulance, and a lot of the time they can get that EKG over to the ER, and the ER knows that the person is coming with a heart attack, and they can get us called in if we're not there, and even send me the EKG at home so I can look at it. And
So you can have your team there ready to respond right away. As I said earlier, we want everybody to be able to recognize and survive a heart attack. As a cardiologist, is there any other advice you would give patients about heart attacks or heart health in general? Anything that you want people to take away?
So we've hit a lot of the high points. You kind of summarized it well. Don't try to downplay it. Don't try to ignore it. As soon as you think you might be having a heart attack, that's the time that you want to call 911 and get it started. Other things you can do in terms of trying to survive a heart attack. So you call 911, chew an aspirin, that can help. If you have nitro at home, that can also potentially relieve some of the blockage and some of the pain. Next things that you can do would be, at that point you have the ambulance on the way. If there are other people around you, let them know what's happening, because if it becomes unstable and the heart stops, they could potentially perform CPR while the ambulance is en route. And then once you come to the ER, once you get there, be very clear. I think a good thing that you can say is, I think I'm having a heart attack. One, again, just in terms of, from our side, we're wanting to get things started and get that ROE open. So when you come to the ER, it's important to just be clear about your symptoms. Don't, provide unnecessary detail or say, I think I'm having chest pain, I think I'm having a heart attack, and then we'll get the EKG started right away. So.
All right. Well, Dr. Cook, thank you so much for joining us today. And you can find more information on heart attacks and other heart conditions and all services available through Blessing Heart and Vascular on our website, blessinghealth.org. Thanks so much for joining us today.
Thank you, and we'll see you later.
Thank you.